along with CHT Secrets, and I'm here to answer your questions. So, whether you have asked me a question by emailing me, by DMing me on Instagram, or leaving me a comment in our videos, I want to answer your questions. So, one of the questions that I received is if I'm interested in getting into hand therapy, how do I know which hand therapy CEU course is a good course? So I can only talk from my experience, and when I first graduated, it's not like I came out and started right away in a hand therapy clinic working next to a certified hand therapist or even a hand surgeon. I started working in a lot of different environments, in different settings, before I ended up going into an outpatient hand therapy position. So when it comes to taking courses, one of the things that I recommend, number one, is to take number one thing that I recommend is to take at least one course a year. If possible, you can try and do two. I know, like, if you're a new grad, it's a little bit difficult because you're thinking student loans and all this stuff, but honestly, just because you graduated, it doesn't mean all of a sudden education's off the table. I mean, I still take tons of classes all the time. It's just whatever you can do, but if you can commit once a year taking a class. So now it comes to a good part of the question: which class do you take? And I think the biggest thing is taking a class based on your learning style. Do you like to do live classes, or do you like to do online classes? Now, obviously, there's a bunch of stuff online right now, and there's different platforms, so you just have to pick which one do you like best. Do you like to take live courses? I am actually a huge fan of taking live courses. It makes me commit to that time. It's Saturday, Sunday, or Friday, Saturday, Sunday, whichever one. I like to go there, and I like to just get my class done with. I have taken online classes, and I am not necessarily the best when it comes to it. Even though it's convenient, you do it from your home, it really takes a lot of commitment on your time to do them. And then the other one is kind of like a mix, right? Where it's an online class, but it's live. So those are kind of hard to come by. There's not too many right now, but I think that there's going to be something coming in the future. So those are the three types, I think, of courses, and you just have to pick which one you learn best from, or which one's the best for you, and then go from there. My third tip is, what setting are you working in right now where if you took a course, you could apply it right away? So let's say you work in a skilled nursing facility or in a hospital setting, but you want to take a class that's more geared toward hand therapy, quote unquote hand therapy, versus, let's say, taking a pediatric sensory integration class or a cognitive perceptual class, because you're working with a lot of strokes, right? So pick a class that you can really utilize your skills right away. Anything that is a manual therapy class, I think, will be really good. Anything that relates to a general topic of the arm. Shoulders are a really huge thing. I'm a big fan of certified hand therapists and hand therapists working on the shoulder, because I just have a patient right now. He came in for a broken hand, but let me tell you, people who come in with hand injuries, when they are stuck and they don't move well, start to have elbow problems and shoulder problems, and you want to be able to be the person that can help them with this problem and fix them 100%, not just with their fingers and with their wrists. So there's kind of like beginner classes that are shoulder classes, elbow classes, wrist and hand classes, or just a general manual therapy class. Those can be really good for you as well. it's something that you can apply right away no matter what setting you're in. You can apply to people that you see in a nursing home or home health that have shoulder problems. Who doesn't have shoulder problems? So many people have shoulder problems. Um, you don't have to go and dive into taking like a flexor tendon style class or complicated surgery cases if you're not seeing those type of surgeries. It's just you're gonna take it, you're gonna enjoy it, but then you're not necessarily gonna be able to use it. Or, one of the things that we do here at my clinic is we do instrument assisted soft tissue mobilization. But if you're not working in a setting where you're able to utilize it, or if you don't have the tools, like, why take that class? You're not going to be able to apply it right away. I had a therapist tell me she took that class, and what do? You don't have the tools, you're not utilizing it on anyone. I mean, it's a great course. I love it myself. I've taken it myself, but if you're going to pick and choose, let's start with one class or two classes a year. Let's pick based on your learning style. Do I do online classes? Do I do live classes? Or do I do a mixture of a live online course? And then 3, picking something that is just gonna help you be able to utilize it right away. So I hope that I've answered your questions. Please keep them coming. And you can always make a comment on this video and ask your next question. Make sure that you like the video, subscribe, so that you can hear more of the questions when we post. And as well, you can follow us on Instagram, CHT Secrets, and you can DM me there if you like. So I hope I've answered your question, and please, I look forward to getting more questions from you so I can answer them as we go along. Thank you.